I'm Jennifer from the Oncology Pharmacy. Have you ever wondered what is involved in the preparation of your chemotherapy medication and what happens in the chemotherapy suites? The preparation of your chemotherapy medication involves a number of steps with the aim of ensuring that your medication is carefully and correctly prepared and individualized for you. Let us take you behind the scenes to see what takes place while you're here waiting at the ATU. Upon receiving your electronic prescription, the pharmacist will review the order. If there are any clarifications required, the pharmacist will contact your doctor before proceeding. Once approved, your medication label will be created with all the necessary information and sent to the compounding lab for our specially trained technicians to prepare your medication. Once the label is in the compounding lab, the pharmacy technician will gather all the necessary items needed for the preparation in a tray. Only one preparation is placed in each tray. The drug, together with all the items required to compound the preparation, is recorded by taking a picture of it before it is actually prepared. Here, the contents of the tray are checked one more time to ensure that everything is correct. The tray containing the drug is then transferred into the biosafety cabinet for our technicians to prepare your medication. The biosafety cabinet is an equipment used for the preparation of your drugs to minimize any potential contamination. Once the medication has been prepared, it is transferred to the pass-through hatch for our pharmacists to carry out 2 further checks. Meanwhile, the screening nurses in the ATU will review your blood test to determine if you are fit to go through chemotherapy. For patients who have registered using the self-help kiosk, they will be called to the screening room for the nurses to perform an assessment. After collecting your medication, the nurse will then call you into the chemotherapy suite and to your assigned treatment chair or bed. If your blood pressure is high, you will be resting in the chair for 5 to 10 minutes before the nurse rechecks your blood pressure. This symptoms assessment will be performed by the attending nurse, but if any of the symptoms requires medical review, the nurse will then inform a doctor to attend to you. The attending nurse will perform the first check of your chemo medication against the order on the computer by ensuring that details such as patient's name, drug, dosage, and infusion duration are correct and match the prescription order, and that your blood test results are within acceptable range. Upon completion of the first level of checks, another nurse will be activated to perform a second independent check on the medication to ensure 100% accuracy in the prescription order to prevent any medication errors. Meanwhile, the attending nurse will prepare and prime the infusion tubing in the preparation room and obtain the needed requisites for your chemotherapy treatment. Once the second nurse completes her checks without query, the attending nurse will begin establishing the venous access on you and commence chemotherapy administration. Some patients may experience some hypersensitivity reactions associated to a specific group of drugs, and these patients will require assessment. Thereafter, the patient will be monitored closely to ensure that the drug is safely administered. As you have just seen, your journey at the ATU involves meticulous processes, and we take many precautions when preparing your medications and administering it to you because your safety is of utmost importance to us. Chemotherapy medications can be expensive and take time to prepare. Some medication orders cannot be prepared in advance of the patient's appointment, as the patient may not be able to receive treatment. In addition, some medications have a short expiry date once they have been prepared. Hence, the medication can only be prepared once the patient has arrived. We hope that this video has given you a better understanding of your journey here at the ATU. We thank you for your patience and kind understanding.